Good morning, doctors. Welcome again. Today we are going to discuss about Addison's disease, adrenal crisis, or adrenal insufficiency, or hypocortisolism. Similar terms. So this time I am going to explain you. You can watch the theory of Addison disease. Now let's start. Which of the following is the most common cause of Addison disease in India? That is autoimmune adrenal insufficiency. Autoimmune adrenal insufficiency is the most common in whole worldwide, but not in India. HIV is no. Postpartum pituitary insufficiency, that is Sheehan syndrome, that is not common. Okay, but in Addison disease, that is primary hypocortisolism or hypoaldosterone secretion or adrenal insufficiency. The most common cause in India is tuberculosis, TB. Even we have the same patient. So TB is the most common cause of Addison disease in India, or we can say adrenal insufficiency. Okay. Now, incorrect about Addison disease is there is hypoglycemia. Yes, because there is low cortisol level, low glucocorticoids, and low aldosterone level. Hypoglycemia. Hypokalemia here, no, there is hyperkalemia because aldosterone is under functioning here, not proper secretion. So what was the work of aldosterone? Aldosterone responsible for absorption of sodium and removal of potassium, but here the aldosterone is poor functioning, that's why they can't able to absorb sodium, so there is hypokalemia or not able to wash out potassium from the body, so there is retention of potassium, so hyperkalemia causes. So answer they are asking except, so hypokalemia is included here. Loss of axillary and pubic hairs, yes. And salt craving, as I already told, there is hyponatremia. Why? Because they can't able to retain sodium due to aldosterone. Okay. Now, adrenal insufficiency causes all except adrenal insufficiency, not enough steroids, not enough cortisol, not enough aldosterone, mineralocorticoids. So low blood pressure, yes. Decrease in ECF, yes. And increase sodium potassium ratio, this is false. The sodium potassium ratio is decreases. Increase protein breakdown, of course, yes. Okay, so answer here is C. Okay, all are seen in Addison disease. Hypotension we see, hyponatremia as I told, and hyperkalemia, yes, we can see, but D is metabolic alkalosis, no. Here we find metabolic acidosis in Addison's disease, so D is the answer. Let's discuss more MCQ. A predominantly male patient mentions that his childhood sexual development was a bit turbulent because of 5-alpha reductase deficiency. What is function of 5-alpha reductase? 5-alpha reductase function, let's discuss direct answer. It turns testosterone into highly potent dihydrotestosterone. So this one is the answer. And alpha reductase inhibitor we give in prostate also to reduce the size of prostate, that is dutasteride. Okay, so turns testosterone into highly potent dihydrotestosterone. Okay, now a predominantly male patient mentions that his childhood sexual development, we already discussed this. Okay, another MCQ. A 48-year man with a family history of heart disease has followed a heart healthy lifestyle for 15 years. However, he has recently experienced usual fatigue and lightheadedness, especially when rising suddenly. Physical examination demonstrate postural hypotension and darker than usual complexion for midwinter in the Midwest. He works and exercises indoors. Lab work reveals that he is hyponatremic, hyperkalemic, and hypocalcemic. Further blood test order assay plasma corticotropin releasing hormone, corticotropin, ACTH, and cortisol level. The combination of hyper and hyposecretion for these hormones would be most likely given this man signs and symptoms. This is a case of adrenal insufficiency, or we can say it's a Addison's disease. Why Addison's disease? Because there is a hyponatremia, hyperkalemia, hypocalcemia, postural hypotension, fatigue, weakness, all give the symptoms of. So what happens in Addison's disease? There is hyper secretion of corticotropin releasing hormone and hyper secretion of ACTH secretion, and cortisol it represent the hyposecretion. So B is a right here. Why when cortisol is low, then ACTH is high, okay, due to inhibitory action. Okay, so B is right. Now, okay, let's discuss this one MCQ. A patient with lethargy, nausea, and reported muscle weakness is given a series of tests to rule out physical causes. During this test, he is revealed that the plasma corticotropin is above the normal. Okay, cortisol is below the normal, and cortisol below normal, renin is above normal, and aldosterone is below normal. Aldosterone low, cortisol low, but corticotropin hormone is high. Adrenal androgen are below normal. Which of the following clinical condition most likely to produce this set of sign and symptom? This is Addison's disease, clear cut. This is the Addison disease case. So guys, I already discussed. If you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. Thank you. Good day and goodbye. I hope about Addison disease it's very much clear. Those who are still not watching the lecture about Addison disease, please go through that lecture. Thank you. Good day and goodbye.